Good morning, everyone. Thank you for joining us today. My name is Dr. Medyanik. I am a regional sales manager at Polytex Technologies, and today with me is Kerry Dellar, our UK sales manager. And we're excited to share with you our collaborative efforts with the NHS and facility management team in embracing automation in healthcare scrubs management. So this presentation will walk you through the challenges NHS faced, the innovative solutions we provided, and the outstanding results we achieved. And just before we start, I would like to tell you a little bit about our company. So Polytex Technologies is more than 20 years on the market. We have more than 6,000 installations all over the world. Now we are growing fast in the UK. We have many installations within this year. And let's start. And let's start with the problems caused by NHS scrubs wastage. First of all, it costs a lot of money. Secondly, it harms the environment. NHS spends approximately £50 million per year because of this. And it also creates almost 8,000 tons of carbon emissions per year. These numbers demonstrate us why we should find a better way how to manage scrubs in the hospitals. But maybe you're wondering, why this is happening? Managing scrubs in the NHS is a hard manual work. There is a lot of scrubs, but always not enough in the correct sizes and colors. So staff ends up keeping their scrubs in lockers for days, forget about them, and sometimes mess them with the dirty clothes. It leads to unnecessary laundry and poor hygiene levels. Facility managers also can't track the scrub usage and deliver scrubs to every department a few times per day without any control. Let's explore solutions to these problems and how automated scrubs management system can simplify the processes. And now I'll hand over to Kerry Dellar, who will present you the case study from Watford General Hospital. It's our recent installation. We are very proud of this. So Kerry, please, stage is yours.
Thank you. Hi, everyone. So we've recently installed machines into Watford and St Albans Hospital, and we have Darryl sat at the front from Watford and St Albans, who is going to help us a little bit with our case study. So, why? So, Watford and St Albans had the following issues, which will sound very familiar for you, a lot of you guys. So, lack of scrubs, theatre start times being delayed, no control over the usage, and also locking out the unauthorised people. So, people from other departments coming to take their scrubs. So what we did is we installed a D200 into Watford and one into St Albans, and the return unit as well to return the dirty scrubs. And so we fixed their issues. The results were they now have full control over their usage. They can see who is using their scrubs, who is returning their scrubs. They have full traceability. Facilities can also prove what they've sent to the laundry. So that no more, we've sent you back what you sent us. They have full traceability of exactly what's gone back to the laundry and what comes back. We also have installed a smart cabinet, which isn't up and running yet in Watford, but will be used for ambulance linen, which we're going to get up and running in the next couple of weeks. So this is how it works. So the user swipes their badge, they select exactly what size they need, then they press the green tick and the machine dispenses their scrub. It will save their size. So the next time they use the machine, it will automatically save their size. So it saves their favourite. There you go, that's finished. For the returning of their garments, they swipe their badge again, they put their dirties in, they shut the chute. The great thing is, it takes a photo. So if anyone decides they want to put a pair of Crocs or a white towel in there, you can instantly see who's done it. Also, the RepairMate software. The reporting side that is at the back end of our machines is very important for everyone. It tracks your usage. It tracks. You can run reports on what's been used, what's come back. You can track users that haven't returned scrubs. The picture on there is what it takes. So when they shut the chute, it takes a photo. So instantly you can see what's gone into the machine. You can automate reports as well. So if you want to know on a weekly basis what's come out, what's come back, you can have that so it's automated. The most, I think, a good one is inventory. So you might have lots of triple extra larges or lots of double extra larges in your stockpile. Actually, you might not need them. So you can run an inventory report that will tell you, actually, you don't need that many. So you can reduce your inventory or up your inventory for the sizes that is needed. On here, it's just a quick overview. So it tells you the health of your machines, whether the network's on, whether the machine's full. You know, when Darryl logs on, he can see instantly what's in his machines, what's needed. Alerts. We can set alerts, and the alerts are important for different people. So the person loading can have alerts set if the machine's run out of stock. The person like Darryl might want to know if the machine's down or if it's running out of sizes. So you can set different alerts for different people. So these are the results. We have over 550 users registered for Watford. St Albans only went live last week, and I finished the go live yesterday. They're up and running now. 7,000 workwear items were dispensed in Watford just last month. It only takes 10 minutes to fill the machines. It holds over 600 items. So it's a super easy system to use. No more top-up inventory calls for facilities. That's a big thing because, you know, we all know that once the team loading the shelves have walked away, an hour later they're ringing up saying we've got no scrubs left, and you're like, oh no, I only just loaded them. Where have they all gone? Tell you where they've gone. They're in staff's lockers because they've just taken a stack of mediums and they've put them in. And then what happens is when your surgeons and consultants turn up, who are the last to get their scrubs, they're gone. So, you know, we did a scrubs amnesty as well, didn't we, in Watford, where you guys did, and it was interesting to see how many staff were turning up in their scrubs to staff. But this is, would you recommend Polytex machines to other hospitals?
Absolutely, yes, absolutely.
Right answer, Darryl, right answer.
It's agreed. We've already put it in St Albans, and we will look to put it elsewhere across Watford probably because it's bigger. But
yes.
No, absolutely, the benefits have been. I must admit, when I first heard about it, I thought, is it going to be that useful? But actually seeing it in use daily, it's been, it's really, really good.
Perfect. So, and obviously, look,
there's a picture of me as well.
Look,
I've been
Darryl,
set up here.
Jan, and Colin. And the main benefits of a scrub, like the scrubs machines, is the 24/7 availability for staff. It's reducing linen losses and shortages. So it makes sure that the scrubs are available when the staff need them, which is the most important thing. And like you were saying, infection control, love them, because it means not everyone's got their hands over all the scrubs. Easy inventory management, this is with our PM8 system. I know Colin and his colleague Colin are running reports all the time and looking at the system. And 24-hour. When I was at St Albans yesterday, a member of staff from Watford come to the machine and said, I love them, as she was getting her scrubs out for St Albans. And we're reducing the waste, we're cutting, and we're hitting the net zero goals. Now I'm going to hand over to Maria to go through net zero goals.
Thank you very much, Kerry. Thank you very much, Darryl. So in Polytex, we're committed to achieving net zero goals. And because we can control the scrubs usage, we can avoid unnecessary laundry. So it means we can save water from this unnecessary laundry. We just don't need it. We can reduce the pollution of detergents. And we can also reduce the amount of textile on the planet because you don't need so many scrubs, because there are no losses anymore with our system. There is no unnecessary laundry. Only scrubs you really need is in usage, so the amount of textile is less. Also, the machine has a sustainable design. It stores 600 items of garments on only 1.5 square meters, which is very space-saving. And the machine by itself consumes less energy than a coffee machine. So with Polytex machine, facility managers get full visibility and control over the scrub usage. Now you know exactly which items were sent to the laundry, which items were returned to the laundry. You can now prevent the situation when the laundry says to you, you know, you have so many losses. And now you see, no, this is the report. We don't have any losses. We sent everything to you and you didn't return it. You know exactly which items are sent to which department. So managing scraps becomes a very easy process, very transparent. It helps you to predict future purchases with the software. You know exactly which items you use, which items you don't use. So for the next year, you know exactly what to order for every department. So very easy system. When we install the machine, we provide the full training for the managers of the software, for the employees how to work with the machine, how basically to tap the card and choose the items, which is very easy. We stay on site at least 1 week to make sure that everything is working smoothly. We use the same cards for the machine as normal NHS cards for the doors, so it's nothing special or extra. So very easy, very convenient, and to be honest, only good reviews about our system. So thank you very much for your attention. I hope this presentation was beneficial for you. We have also our machine in the booth, so please come and try our machine by yourself and we can explore how it can benefit your hospital.